Hey everybody, today is National Squat Day. I made that up just for the record. Anyway, today we're going to be talking about squatting. The reason why is because a lot of people really don't know what happens with squatting as far as how low they're able to go or even how to do it. Today we're going to be talking about exactly what happens at different degrees of a squat as far as going from a full standing position to butt below the knees. Okay, so I took the time to make these little drawings here. Okay, so let's take a look at some of these angles. Here we have a 30-degree angle. A 30-degree angle looks like this, and this is what it might look like with a squat. Okay, at the 30 degrees, what we end up having is we have the ACL, which prevents anterior translation of the tibia, this bone here, from moving forward. So, contrary to what some people may think, the ACL actually reaches its full tension only at 30 degrees of squatting, which isn't that much. So that means when you go lower, it actually evens out and there's less tension throughout the ACL. Something similar happens with the PCL, and that's at about 60 degrees, but the PCL actually reaches its peak. This is a 60-degree angle at 90 degrees. Here we have a peak PCL. That means the PCL, that's the ligament that actually runs the other way from the ACL, prevents posterior translation of the tibia to go even further. So when we look at the ACL and the PCL, really within the first few degrees of motion, from about 10 degrees to 90, not even, will reach your peak tension. Peak tension, peak tension. Okay? As we get lower, that's when some potential things may happen to the meniscus. So the meniscus ends up having bearing a lot of load at about the 135-degree angle. The 135-degree angle looks like this, and here's this guy squatting at a nice 135-degree angle. The correlation between the two hasn't really been set, but if there is a meniscus injury, then you may not want to go as low. So let's take a look at some muscle activation. When we look at muscle activation, the hamstrings are pretty tense from 10 to 70 degrees. What that means is that from your starting position, a standing tall position, to something that may look like this or something that may look like this, the hamstring is engaged. It will level off for the rest of the squat. That means it'll just maintain its tension and not increase or decrease, whether you're at a partial squat, a squat at 90 degrees, or a squat at the full 130 degrees. Okay? If you're looking to train the quadricep, the peak action ends up happening at a 90-degree angle here. Okay? But notice how we haven't reached the glutes yet. The glutes are the back of the leg, and they're going to create the most amount of power. If you want to train the glute max and have power, you have to go below parallel. That's about 120 degrees. That's about 135 degrees. The glute max has been shown, and studies have shown, that if you actually go below parallel, that's when the glute max will engage. And it will engage in the beginning at the top, but as far as muscle activation, and this was shown with EMG studies, more activation is below that 90 degree. So if you're just stopping at 90, then this is what you're doing. You're stopping at the apex of the PCL, and you're really only training mostly the quadriceps, which are on the front of the knee. Okay? So your homework is to go ahead and learn how to squat. One thing that you should know is that if you have an ACL or PCL injury, you probably don't want to go below 30 degrees. Right? If you have an injury of the meniscus, depending on how badly it is, you might not want to squat at all, but you definitely don't want to go below parallel. If you are looking to train the glute max, you're going to go below parallel. And if you're looking to train the quadriceps, you stay right there. But keep in mind that the apex tension of the posterior cruciate ligament is going to be at that 90 degrees. So that's something that you may want to just think about when you're going to squat and why actually you are going to squat. my advice is to work to train to get below parallel so that you actually utilize all of the functional muscles in the chain. If not, then you have to first address any kind of pain that you may be having, and if not, then learn how to squat correctly. All right, everybody, have a good day. By the way, all these are I just drew them freehand, and yeah, that's what my drawings look like.